Well, those days in the sun, like these ladies are enjoying and these folks here, are about to come to an end, and you have probably done a lot more damage to your skin than you've realized.
We brought on a nationally known leader in the field of plastic surgery. Dr. Peter Capizzi is here with us. Hopefully not staring at our skin too much to go, look what you've done, look what you've done. We, I know, have both spent way too much time in the sun as kids, not protecting as we should have. So we know what we're supposed to do on the front end. But let's bring it to reality. We're here, we're noticing every day, you know, now that I'm in my 40s. You're a long way off page.
We're noticing every day. What? You sit close to me, I know.
You know, we have changes in our skin, some spots, and all kind of things are changing.
Well, you know, I think I love talking about this because we have so many good things that have come along in the last year, a few years, that work much better. Everybody knows about sunscreen, so there's no product that's going to wipe away 40 years of sun damage. There's only so much frosting on the cake that you can put on to make it look good. So you have to think of it as a process of the product and the procedures that you have for the individual, and kind of marry that to their activity level, their genetics, and kind of the sun damage that they have.
But I'm glad you said that, because that's what we were talking about before, and I don't know about you, Jace, we've never talked about this exactly, but I was a lifeguard, I know, when I was in high school. Never wore sunscreen, because of course I wanted to get the deepest, darkest tan I possibly could, and I never noticed damage then, but now you see the sunspots and the freckles and the wrinkles, etc. And I mean, is it so, you can't really go back and change that, obviously, but moving forward, you can make it so that you don't increase that damage anymore, right? And you can kind of freeze it where it is?
Oh, that's correct. And you have to kind of maintain that, so it's not just a one-time thing. There are some things that are, you know, one time, let's say, as a procedure, but then there are others that you have to use them maybe a couple of times a year or every year. And we have some.
Yeah, so you were talking about marrying the products with the procedure. So let's kind of start. I mean, I'm sure there's different levels. For someone who's like, okay, I want to, let me do something. I'm a little fearful of taking a major step and a major financial investment. What are some basic ways that we can step into repairing some sun damage?
So everyone knows about skincare, sunscreen, chemical peels. And chemical peels can be adjusted to the level of sun damage. So that's a very easy
That doesn't sound like the mild entry-level option. Chemical peel. We need to come up with a more PC name for that, I feel like.
Yeah, they should.
It's like a facial, though, like an intense facial?
Right, so like Skin Medica has Rejuvenize. That's a chemical peel of sorts. There's Vitalize. So those sound a little bit better.
Those do, yes.
There's also light-based treatment, like broadband light. So if you think of broadband like a flashlight, light treatment can actually wipe away some of the age spots or sunspots that you get over the summer.
All right. So the good news for you, there's hope for you, Jason Harper.
Oh, good.
And those are the rest of you at home who
Thank you very much. And I know that's just a small portion of what is out there, so just make sure you check with your, you know, the experts on what to be done, because everyone has different skin, different levels. Thank you so much for being a part of the show.
Oh, you're welcome.
Appreciate that.
Glad to.
We'll be back in 2 minutes, guys. Come back for more.